What I think makes the Riverside Residency program so special is that it's not a very large academic center, but it's still an excellent academic center. And so when you're a resident and you're rotating here, you actually get much more individualized attention from the attendings. So for example, if you were going to be rotating with me as a resident, it would just be me and the resident, as opposed to having a set of fellows, a set of residents, a set of medical students. So you really get more individualized one-on-one teaching and one-on-one attention.
There's no competition within this hospital as far as one program having preference to specific procedures or rotations versus the other. We try to keep a level playing field for all of the programs so that learning opportunities are not diminished or biased towards one program or the other.
Riverside is a tertiary care institution, and we basically have every surgical subspecialist is represented here. So there is a lot of material here that residents will see during the course of the rotation.
We want our residents to feel comfortable. We want them to own the patient. We want them to have enough autonomy that they can take decisions independently, work the patient up. We allow them to have discussion with their families. And in the same time, we provide them with enough knowledge and didactics and enough supervision so that they can learn taking care of this patient in a safe environment.
So they come away with a comfort in what we try to get them to look for so that they're comfortable maybe maintaining or keeping some patients with more common conditions that are treated conservatively.
Residents add so much to the patient experience. They're often the first person in the area that they're seeing, let's say for instance family medicine or OB, that the patient is going to see. So they're that first encounter that they have with that specialty or that group. So I think it's super important, that relationship that you have kind of from the very first moment that they meet. And I do think that the patients really do see that and see that extra care that they give.
Helping to train them often just reminds me of the important things about patient care beyond just the nuts and bolts. They are excited about what they're doing, and it's great to see their passion for the patients, to see them excited about giving them a better outcome and doing everything they can to make that happen.
At one point in all of our training, we all were taught by someone else, and so the approach has always just kind of been trying to teach them the knowledge that I have, and hopefully they can kind of take some of those techniques, with them wherever they go and continue that process.
I love teaching Riverside residents because it keeps me on my toes, number one, and it feels rewarding to see someone else carry the knowledge you're passing on and potentially help patients for the future.